Welcome back, massage nerds. Today I'm going to show you how to treat, how to test, treat, and how to do some kinesio taping for plantar fasciitis. So the test for plantar fasciitis is you flex the big toe as far as you can, where it's comfortable, where you don't hurt it too much, and then you're going to press like right here, starting right below, and see if there's any pain there, and you work down all the way down right here on the medial side. And I can tell she's got some tight. This was tight, but I know that you don't have a lot of pain there, right? Okay, yeah, you can feel that it's tight. Really pulls this. You can really feel the plantar fascia. The plantar fascia right here on the tubercle of the calcaneus, this is where it's the most painful on people. When they feel pain, they feel it right here on the calcaneus, the medial side of the calcaneus, the tubercle of the calcaneus. The plantar fascia is a really tight band, and it pulls. It begins here and it pulls, and then this connects with the Achilles tendon. So I'm going to show you how to do the flossing for the calcaneus or the Achilles tendon, how to release it and how to work it. The plantar fascia works as a shock absorber. It it supports your arches. So with people that have flat feet or real high arches, it's common with joggers, people that stand on their feet all day long. So you must treat this right here. It's common on people that are like between the ages of 40 and 70 years old. Also, so I'm gonna work this foot because I don't want to smear the painting on that, but let's pretend that she does have plantar fasciitis, and it's really painful here. So I have this ice stick. It's really cold, I'm sorry, but you can tell I had it in the freezer. So I'm gonna work with this, just run it along the area where it hurts so that she can it can go numb, and then I'll be able to work on it, especially with people that have plantar fasciitis. I'm trying to stretch that fascia and just work on it just for a few minutes. The ice will make it numb pretty fast. And once you've had it on there, don't go tentatively. Let your client know, take a deep breath, and then you start, once they exhale, and you do a pretty firm touch. Okay? So once it's pretty numb and it's nice and cold, very cold, it's very cold to the touch now, then I'm going to start doing some work. One of the first things that you want to do is, I start with separating the metatarsals on the top. I'm just spreading here, spreading the metatarsals on the dorsal. This is the dorsal side, this is the plantar side. So plantar flexion is when you're flexing this, dorsiflexion is when you're flexing the dorsal side. So I'm gonna do some spreading here, just feeling how tight her foot is. Okay, then I'm gonna do some figure eights just to see how much movement she has in there. And you need to remember that the plantar fascia begins here and it continues even with the Achilles tendon. So you want to treat the Achilles tendon, you want to treat the gastrocnemius and the soleus. So once you're done with the figure eights, which is pretty flexible, if you want to put your fingers in between her toes, gives you a little separation, and just do some circular motion here. You can do 8 to 10 of these, and this just make sure that that you're not pushing too hard, and then you go the opposite way. I'm just trying to see how much flexibility she has, how tight is that plantar fascia. Plantar fascia is felt the worst in the morning when you first wake up, and I'll tell you why. Because when you are asleep, your foot relaxes, so it's kind of like this, and then when you get up in the morning, it goes like that, and it creates micro tears right here around this area. That's why it hurts here, because this is where it starts tearing the tissue, the plantar fascia, and it's very painful. So when you're numbing it, I'm going to use the ice again. So take a deep breath. You want to make sure and just work on this area with the ice really good, so that it'll numb it and it'll go right where the micro tears happen here. And that's what the Kinesio tape is for. The Kinesio tape is for you to keep your foot a little bit, a little bit in flexion, so it doesn't relax so much that when you get up in the morning and you put it in this position, it's just so painful. So now you move on to the next, and you can go ahead and separate the muscles here. You can work from the top down. And all I'm doing is just going with my thumbs and just separating the tissues. Nice and slow, nice and wide. And then you can do some cross friction here. Just trying to separate and lift and bring some relief and relaxation. You can go to the lateral side. I like to treat all of it. I would spend like 20 minutes on the foot, especially if they have plantar fasciitis. And then the medial side. And then right in the middle. And once you've done that, you can make your fist into a soft fist, soft taco fist, and then just glide down. You want to glide down from the lateral, the medial side, and right here in the middle. And by now that you've been doing some movement here, you're able to tell where the tightest part of her foot is. And most people, like I said, it's right here in the, right here in the, where the calcaneus is, the medial part of the calcaneus. That's the biggest tarsal, the calcaneus, and that's where the Achilles, this would be the Achilles tendon attaching. So it's like one continuous tendon. If your Achilles is tight, it's going to pull, on this part right here too. So you must work all of this. So now I'm going to go ahead and continue working. Speaking of the Achilles, I'm going to just, all I'm doing is pushing my fingers towards each other, pressing on that calcaneus. Relax your foot. Thank you. Relax your foot completely. I'm trying to push it against each other and feel with my fingers how tight that calcaneus is. And remember, the calcaneal tendon, which is the Achilles tendon, attaches the gastrocnemius, the soleus, all the posterior muscles to the heel. So you must work this area here. Okay, once we've done with a soft taco, with a soft fist, then you can do with an open palm too. You can just glide down all the way down with an open fist. And you want to treat it both supine and prone, because there's actually lots of, nice things that you can do when they are prone. Some nice stretches. And speaking of stretches, that's what I'm going to do. Now that her foot's a little bit more relaxed, I'm going to do some flexion. I'm pushing with my fist so that I don't put my wrist at a 90-degree angle. I'm pushing with my fist, flexion, then grab the top and just do some extension. I'm able to create a little bit more movement here. Flexion. And extension, flexion, and extension. Okay, now that you've loosened it up, you can start maybe using some tools here. And I'll show you here what I'm going to do. I'm going to do some specific work. So now I'm going to, once you've relaxed the foot a little bit more, I'm going to start doing some specific work. And you can use the bevel tool and just to glide down. I'm going down each strip like that. I'm going to go down, okay? And it's from the base of the foot and just kind of drag it. And you'll be able to feel, you'll be able to feel where it's really tight on somebody that has they feel like little crystals, like it feels really hard. You can do one glide at a time, glide down each at a time. And right here, even on her, I can tell that this is a little bit tight right there. So I want to spend a little bit of time there. But like I said, this is where most of the clients feel it, right here on the heel. And if it's too much pain, you know, again, go with the ice. Try to numb it. If it, you know, if it's not numb anymore, you know, try to numb it again with the ice. You can tell your clients to get a 12-ounce bottle of water and put it in the freezer, and you can try to, you know, do it with that too. Make sure you get it nice and numb. And then you can go back and work on it again. Try to spread that plantar fascia. And trust me, people that have plantar fascia, they will thank you. Like I said, I've seen it mainly, I've worked them mainly on runners. You know, they just tear all these, they have all these micro tears. So I haven't used lotion up to now, but I'm going to use a little bit of lotion now, because I am going to use the, you know, the washer. You can use a spoon. You can use just a regular spoon, you know, and come down. You can get a regular spoon. It doesn't even have to be, this is a little thicker so it doesn't cut as much. Or you can even get the back of a knife, not a sharp knife, a butter knife. The ones you put butter with, not a sharp knife. But you can also get the, you know, the back of a utensil and just scrape. Actually, my acupuncturist friend showed me how to do it even with a credit card. So you can really, just really get the plantar fascia here to start stretching when you've done all this work. Or like I said, for something that doesn't feel as invasive, you might want to do the back of the spoon. And another one that I have here is my washer. This one works really well too.
In the camera a little bit.
So what you're trying to do is stretch out that plantar fascia. And like I said, the micro tears are usually around right here. This is where the micro tears are. That's where it gets really hot and red and inflamed. Now sometimes the plantar fasciitis is confused with heel spurs. So make sure that you know that you have the correct diagnosis from a doctor, that you know that it is plantar fasciitis and not just heel spurs. So again, after I've done the deep work, I go back and I redo all the little strokes just to try to relax the foot a little bit more, because going with those stools is a little bit deeper and a little bit more invasive. Make sure you treat the ankle and the Achilles tendon and each little toe after that. That's just to make her feel good. To help you relax after I beat you up. Okay, so now from the prone position, again, you can just use the flat palm and glide from the base of the calcaneus all the way up. You can do all the same techniques that you did while she was supine, you know, the cross fiber. You can do all the same techniques. You can do the spreading, because really what you want to do is just loosen up that fascia enough. So you want to go cross fiber, you want to go with the fibers and against the fibers. Again, you can go with a soft fist and focus right here on the heel where it hurts the most. So you're basically doing the same movements. And again, you can get your washer. Excuse me. Look at this. When I was doing it from the supine, I was going down like this. So now I'm just going to go the opposite way. And please remember that you need to stay within, you know, the pain tolerance of your client. If it hurts too much, you can always go back and use the ice again, you know, if it's hurting too much. Work the heel really good. The lateral malleolus and the medial malleolus. So after you've worked the foot really good here, again, every one of the same strokes that you did when they were supine, you can do it while they're prone. Okay, now let's do the Achilles tendon flossing. You bend their leg and you're going to grasp or pinch lightly. Don't pinch it too hard in the softest part of the Achilles tendon. And then with your, either with your forearm or with your hand, if you're tall enough and strong enough, you're going to flex and extend. Flex and extend. Flex and extend. You can do this up to about 10 times. So you're really trying to loosen up the Achilles tendon. And now you can move your whole, like, you know, moving it up superior. Like, you start at the inferior part and then you move up half an inch and then you move up another half inch. The Achilles tendon is the strongest tendon in the body. It's not the longest. The plantaris is the longest tendon, but this is the thickest and the strongest. So you want to make sure and work on that. And another move that you can do is if you place, let me see, their leg out, you can go with your forearm here, and you can also go with a forearm here. Let me put a little bit of lotion because I'm going to start working now the gastrocnemius. So I do need some lotion or some oil. I usually don't use oil at the beginning. As you can see, I really didn't use any oil until I started using the washer. So for the most part, you don't use oil. But once you start working the calf and the gastrocnemius, and then you can lift to separate those fibers. Usually the calf is really tight. The gastrocnemius and the soleus are usually very tight. So you want to separate the fibers, lift. You can do the one where you're lifting. Now you want to separate the soleus from the gastrocnemius, and all I'm doing is pushing my fingers towards each other, just like if I was squeezing a pimple, going up, popping up the gastrocnemius and trying to work right underneath where the soleus is. All I'm doing is pushing my fingers against each other and gliding up. Most of these strokes you can do 3 to 4 or 5 times, depending on how tight it is. You can also use your forearm here. And the lateral side. And don't make fun of me of my body mechanics. I'm trying not to block the camera, guys. And you can also separate the two heads of the gastrocnemius. Remember, they originate here on the lateral and medial condyles of the femur. So make sure you work that too. Just don't put pressure on the popliteus, but you got to work this gastrocnemius and the soleus and the plantaris and the tibialis posterior. All of these muscles here, and the peroneals here, the peroneals longus and brevis and tertius, they're all on the lateral side. And all of these, they attach through the Achilles tendon. The Achilles tendon is pretty strong and pretty tight right here. And they attach on the calcaneus, and then the plantar fascia starts, also connects right here. So imagine it's one continuous, long tendon attachment. So you've got to work all of this. You always work towards the heart, centripetal, towards the heart. Her foot is really loose. So you can also, this is a move where you put your their leg either over a pillar or over your thigh if it's big enough, lifted up enough, and then you can work both at the same time. And if I want to go a little pressure, then I can do with the forearm. So I'm going a little deeper here. Just trying to get some good stretch. Stretch that Achilles tendon. So now you know several techniques. I've showed you how, the why. When this gets tight, the micro tears happen like usually around here, especially when you sleep at night and your foot is so relaxed, and then you stand up in the morning and it flexes again. It really hurts. So make sure you tell your clients if they can either get a night brace. There's a brace that they can wear at night, or you can do some kinesio taping, which is what I'm going to show you right now, the kinesio taping. So I want to show you how to do the kinesio taping. Usually you get they already come pre-cut, but you want to get the longest one to go all the way around like this, all the way to the Achilles tendon. You're trying to create some tension here, and these will be going across. So I'm going to start peeling. Okay, so once you got it peeled here, you want the foot in flexion. You want it to have a good stretch here. So you kind of put it right here. Stretch it. It's a mild stretch, not too much. Okay, so once you get the long one, it should be about 8 inches. Then you get this should be about 5 inches. So I'm just gonna you pull it to tear the middle part, take off the paper, because you want to start in the middle. You want to start with the middle here. Okay, and I'm going to pull it lightly. Okay, pull it a little bit, then hold it. So you want to create a little tension. Not too much, but a little tension. You want to put this right at the heel. And then you're going to put the other one like around right here. And this is all I'm doing, guys. I'm just stretching it to tear the paper, because you want to start from the middle. Okay, so you go like this. You create a little bit of tension right there, and then you hold it. You want the tension right here in the middle. So this way your client they can leave it on for 24 hours. They can sleep better at night, and it'll keep their foot, flexed instead of, like this, relaxing. It'll keep it a little bit tighter, and it'll give it some support. So this is kinesio taping for the plantar fasciitis. Hope you've learned a lot today. There was a lot of information. You're going to spend 15 to 20 minutes working on the whole area here, the whole leg. So make sure you do that and help your clients. Until the next time, create a good day.